Doctors and nurses have been waiting for this moment. They are rolling up their sleeves to get a dose of the Russian vaccine, Sputnik V. Russia has sent 100,000 doses to Venezuela, just a fraction of the number of doses Venezuela is hoping to put into arms.
There are not enough vaccines arriving, not even for all the healthcare workers here.
President Nicolás Maduro says this is the first part of a deal for 10 million doses for which Venezuela paid $200 million. Venezuela is also working on a deal to buy more vaccines through the United Nations-backed COVAX program, using money frozen in the United States by economic sanctions. The vaccine Venezuela has reserved through COVAX would provide enough doses for about 6 million people out of a total of nearly 30 million Venezuelans.
I always have said that massive vaccination comes in April. According to the calculations, I think more or less in April, we will be in an advanced stage of vaccination.
Venezuela's government is also considering buying vaccines on the private market to avoid U.S. sanctions. According to the Venezuelan Ministry of Health, by the end of this year, 70% of the population could be inoculated. But some health experts say this is a tall order, considering the number of doses Venezuela would need to acquire. Logistics are another issue. Venezuela has chronic power outages, and that will make it difficult to maintain the proper temperatures for the vaccines.
Especially outside the capital, there are limitations and restrictions, with no electricity for up to 12 hours in some cases. The possibility of having a constant electrical service and guaranteeing a cold chain is a great challenge for Venezuela at the moment.
COVID-19 is on the minds of Venezuelan health workers who have demanded better salaries and working conditions. They say only a select few have received the vaccine, and they want their government to ramp up its efforts to vaccinate all healthcare workers.
We need vaccines for everyone, not only just for a group. We all need it because we're in the firing line. As healthcare workers, we are most exposed to COVID-19.
It is an open question as to when Venezuela will be able to vaccinate all its healthcare workers, public servants, military and police. Venezuelans outside those categories are likely in for a long wait.